standard has been the norm here and elsewhere, that face-to-face direct contact, closer obviously than the 6 feet, is what we'd be looking for. And so it gives us something tangible to work with and to build that contact tracing around.
Next question is Jen Peltz at the AP.
Hi, Mr. Mayor. How are you? Can you hear me?
Yes, Jen. How you doing?
Good, thanks. A question about the progress indicators. As we've seen, they go up and down day by day. Since even one additional person can be the difference between red and green, how practical do you think it will be for these ever to go down all together in tandem for weeks at a time?
Jen, that's the whole concept here. It's a very fair question, but I want to emphasize this standard was put together on the basis of course, knowing it was possible, for sure knowing it was possible, and knowing that it was a high bar, but also a smart measure, meaning, we do not want to make the mistake that I'm worried some other places might be starting to make of reopening so quickly that you could let the disease reassert and set us all back. We wanted to be smart. We wanted to be cautious. But absolutely, these are attainable measures. And if you sort of think about the common sense of them, if you saw the number of people testing positive going up, or the number of people in the ICU going up, or the number of new hospitalizations going up, that would not be the time to relax restrictions. You really want to have evidence that something has turned the corner more profoundly. So they're common sense to me, but of course they can move. We've already seen movement. And it interrelates with what we're talking about here. We're going to have to use these new strategies as part of the push. So the things we're seeing that everyday New Yorkers are doing are clearly working, but we're going to have to do more. And these kind of strategies I just outlined, they help you get to low-level transmission and then secure it and then push on to the phase we all want, which is when there's effectively no cases at all. So, no, I'm absolutely convinced these can and will move, but they're cautious for a reason.
The next question is Anna from the Daily News.
Hi, Mr. Mayor.
Hey, Anna.
I was wondering, given, the cost of putting on a fireworks display in New York City, both for Macy's and for the city, for security and other measures, is a fireworks display really worth our time, given that Macy's has also furloughed thousands and thousands of employees?
Yeah, Anna, I think those are it's a fair question, but I think there's two separate concepts here. Macy's is a massive company that's been dealt a huge blow here by the economic reality. And that is a much bigger reality than whether they put on a single fireworks display. The cost of a single display is a pretty limited thing in the scheme of things. Again, we're going to figure out something we can do. We have to make sure it is safe, and we're not going to do something that we think isn't safe. We're going to find a version of it that we think is, and obviously would therefore simultaneously limit whatever else had to be done around it. But I think it is right to say it is a sacred day each year. It is a very powerful day. It's part of our effort to fight back, to recognize a day of this importance, but to do it in a different way, and it will be a different way. But I think it's very generous and really patriotic of Macy's to say, no, we had planned on this. We were ready to do it. We're not going to back away from that commitment. But we're all going to find the right way to do it. And it will be something that takes into account safety, and obviously not something that's going to cost a lot of money.
Next question is Gloria from New York One.
Thank you, Mr. Mayor. I'm wondering if you have made, if there's any progress or changes to how the city is going to handle other parts of summer. So you're talking about the July 4th celebration, but have you made any progress on a plan to deal with people going to the beaches, to deal with people who maybe don't have air conditioning at home and need to go to a cooling center that might now not be open because of the restrictions that are in place. What is the city doing to prepare for summer, other than making sure that we have this day of celebration that you're talking about?
Yeah, that's something, Gloria, we've been talking about over the last few days. Obviously, in these settings, we're absolutely going to be unveiling a summer plan that looks at how we can protect people, first and foremost, because we don't know as the summer begins. I mean, some people mark it from Memorial Day, obviously. Other people mark it from when school normally lets out. Whatever way you think about it, we still don't know what we're going to be confronting. What we knew was there were some things that would not be ready. Certainly like opening of beaches on Memorial Day was not going to be a real possibility. And whatever we do has to be with a health and safety focus. So we'll put together a plan and we'll announce a plan that says this is how we're going to begin as we get into the warmer weather. This is how we're going to keep people safe. Knowing that beaches are not opening in the beginning, we still have to protect people who might go to the beaches, but we don't want to see anything like the normal reality of folks traveling. I mean, let's face it, most people go to the beach, they take the subway, they take the bus. That's not happening right now. That's not acceptable right now. We don't want large numbers of people anywhere near the beaches, but we have to protect if people show up in any number to make sure that they're safe. We do need a process to protect people against heat waves. And there are different ways we could do cooling centers, even with social distancing. There's a lot of pieces. A question was raised the other day about blackouts. Great question. Again, I think the situation is different this year in a way that will allow us to handle it differently, but we'll speak to that as well. So a lot of pieces will come together. Now, it is April 22nd. So this plan is something we would talk about in the next few weeks, obviously well ahead of the hot weather. But yes, it is being worked on right now, and it'll be ready soon.
Next is Katie from the Wall Street Journal.
Hey, good morning, Mr. Mayor. I was hoping you can give us an update on some of the announcements you've previously made, particularly when it comes to outreach in the most vulnerable communities. In Queens, in particular, the neighborhoods that have been hit the hardest don't have nitro developments, so they can't really tap into the relief you mentioned today. But can you let us know which community groups that your administration has connected with, community health organizations that you've mentioned to do what you described as grassroots outreach? And I'm curious, I know this test and trace plan, how can it really work if we don't have the tests yet? And why wasn't there, I know that there was a shortage of tests, but a lot of this seems like things, and I've said this before, but it seems like things that we should have done a month ago, or even more than a month ago. Thank you.
Katie, I appreciate the editorial comment, but I got to tell you, it's moot without the tests. I mean, you could say it would have been nice to do it a month ago, but we just didn't have anywhere near the testing capacity. And so I understand the impulse always is a journalist to wonder what could have been, but I think we all lived through this together and everyone had eyes to see. There was barely the testing available to do the most basic work we had to do. And remember, that was protecting the patients whose lives were in danger. That was testing healthcare workers, testing first responders. We cannot forget that 2 weeks ago, a little more than 2 weeks ago, we thought we were about to go into a massive ascent, unfortunately, with this disease. And it was going to take more and more testing just to focus on saving the lives and protecting the healthcare workers and the first responders. And everything we had was focused on that mission, on saving the hospitals so they could save lives. And it's only been in the last couple of weeks that we have begun to come down from that situation and think about reassigning healthcare workers to things like community testing, having enough PPEs, which is a constant struggle. We still don't have enough test kits. We still don't have enough lab capacity for tests going forward. I am hopeful those pieces will keep coming together. But no, there was no way this could have been mounted previously. Now we're building it out rapidly, so we will, as much as we have the testing, we'll be able to act on it. But there has to be a sustained supply of testing to do that. To the other question about the other pieces of the disparity plan, the plan to address the healthcare disparities, we will have an announcement shortly on expanded telemedicine options, and we will have an announcement shortly on grassroots outreach, which, again, we want to engage those clinics, not just for texting and phoning and things like that, but eventually actual on-the-ground work. And as more personnel are becoming available and as the PPEs are starting, again, not out of the woods, but starting to get a little bit more available, that's going to be more possible. So those pieces, expect announcements on those in the coming next few days.
Next question is Yoav from the city.
Hi, Mr. Mayor. I wanted to ask you about the 50,000 tests that were supposed to come this week from, I think it was ARIA. I guess, what is the current daily testing capacity in the city? And will we see those 50,000 tests actually conducted this week so that by the end of this week, the city will have tested 50,000 more than it did last week?
We'll get you the testing capacity previous. The ARIA shipment, we've gotten half of it in now. The rest will be coming over the next couple of days. But remember, before that, there was no widespread test kit source. So everything was much more hand to mouth. And again, the focus on helping the patients in greatest danger, the healthcare workers, which we expanded healthcare worker testing in H&H, and first responders. So we'll get you those numbers of where we've been up to now. The community testing has just begun. The introduction now of a bigger supply, and what we think will be a sustained supply, both from ARIA and from our own production, that's now going to allow us to go to something much bigger. So we'll get you the update on what has happened previous to the supply arriving. But this is literally the first week where we ever even began to have a supply that would allow us to have something that was more of a community-based approach. Up to now, it's been a very hospital-based approach. Now it's going to start to be more and more a community-based approach.
Next question is Julia from the New York Post.
Good morning, Mr. Mayor. I want to read you the response from the head of the FDNY EMT union, Oren Barzilay, to your ticker tape parade announcement yesterday. He said, quote, "A parade does not put a roof over the heads of our men and women. A parade does not put food on our members' tables. The mayor needs to stop his irresponsible treatment of heroic work of EMT, paramedic, and fire inspectors of the FDNY. The heroic men and women of FDNY EMS have risked their lives during the COVID-19 pandemic, and the time is now to pay them what they rightfully deserve. If he can spend millions on throwing a parade, he can do the same with paying EMS. So what do you say to first responders who want you to honor their work with a pay raise, not just a parade?"
Julia, throughout this process, we've been honoring all of the first responders by supporting them with what they need most, which is the personal protective equipment, the reinforcements. Obviously, for the healthcare workers, that meant getting in the military medical personnel, getting in the contract nurses and other employees, the medical volunteers. For the EMTs and paramedics, it means the hundreds and hundreds of ambulances we brought in from outside, and more and more EMTs and paramedics. We'll get you the exact number, but I think the last I heard was something in the neighborhood of 700 or more that we brought in to support folks who do such crucial work for us and to take some of the burden off them. And thank God, as we talked about just a few days ago, the numbers have come way down. We're at a situation now where our EMTs and paramedics are dealing with a number of calls that are much more like would be normal for this time of year. But that extra support was crucial to help them, to take some burden off them. And we're going to keep supporting them. I think Senator Schumer is right. There should be a federal bonus program as part of the next stimulus for all the people who acted heroically here, all of the first responders, the healthcare workers, the essential workers who are part of this fight. The federal government is in a position, which we very, very sadly are not, but they're in a position to provide bonuses as part of a stimulus. Everyone understands what has happened to the city of New York, to our finances in this crisis. But it absolutely should be part of the federal stimulus that's voted in May, and our heroes deserve that. So we're going to fight for that. And I would say, I think the notion that when the day comes, and it could be, quite a while from now, but when the day comes when we can honor everyone, I think people in this city, and I think our first responders and healthcare workers will appreciate being respected and honored. Union leaders do what union leaders do, but the folks who do the work keep showing up. They take their oath seriously. They serve other people. And I certainly think for them, for their families, but for all New Yorkers, the opportunity to thank them and appreciate them is meaningful. And we're going to get a lot of support from outside to pull together that parade when the day comes. But that day is off in the future. Right now, we got to support our first responders in the here and now, and we got to get them those bonuses through the next stimulus.
Next question is Jeff from the New York Times.
Hey, good morning, Mr. Mayor. I have two questions. Can you talk about the hotel isolation program and the challenge it's intended to address? And how much of a role does family transmission played in this crisis so far? And the second question is about the contact tracers. Has the city considered any use of mobile applications to trace people? And do you have any idea how many tracers are going to be needed? Do you have any sort of more details you can give about the scope of the tracing plan? Okay, so
Jay, keep Jeff there for a second. I want to make sure I got this right. Jay will speak to the use of what's been done. And we were borrowing, obviously, to some extent from models that have been at least somewhat effective elsewhere, how technology is used and how people are used. I can definitely tell you, Jeff, that there will be thousands of people employed, whether they are existing city workers, whether they are nonprofit folks who work for the city, or if we have to hire new people. But, I would say thousands and thousands of people doing the contact tracing, 5,000 to 10,000 would not surprise me at all, but we're working on what that exact number would be. Jay in a moment can talk about sort of the technology and all. But the first part of your question about the isolation, I think I heard you say, was it indicative of a certain amount of the problem coming from people living in crowded conditions? Is that the question?
Well, two questions. Can you talk about the challenge that the hotel isolation program is intended to address? And then secondly, what is the role of family transmission in this crisis?
Sure. Okay. I'll start. And again, Dr. Jay Varma can give you a much more precise answer. But clearly, transmission, to the people you're closest to in your life. I mean, we said this from the very beginning, and our health department team said this from the very beginning, that's, the people you spend the most time with, have the closest contact with. If one gets sick, the chance is substantial. It could spread to other people. And when we were doing that early contact tracing that we were going, remember, day by day in the beginning of March over each and every case with all New Yorkers, you could see that transmission within families very vividly. So there's no question that's a real concern. And that concern is amplified if more people live under one roof or they live in particularly crowded conditions. But Jay, I'll turn to Jay in a second on that, and also on the use of technology and the tracing. On the question of the role of isolation, I think this is one of the things that actually falls under the category of common sense, that